Hi everybody, today we're going to do a saline infusion sonohystogram. I've decided to video this because there's a lot of misinformation out there about the procedure and the actual outcomes of the procedure, with a lot of patients concerned that it's going to be extremely painful or uncomfortable. So today we're doing a live actual saline infusion sonohystogram with our amazing volunteer C, and she is here today to do this with us, and we're going to walk you through it. You'll hear me explaining every step of the way, and our procedure hopefully will go smoothly, and you'll see the pictures on the screen as well. So we're going to start. So you're going to feel me just get positioned here, and what I'm going to begin with is just inserting a speculum into the vagina. We keep all of our speculums warmed, and the lubricant is warm too, so this should make it a lot more comfortable. So you're just going to feel me touch on the knees, and you're going to feel me touch over the labia, a little bit of pressure, and if anything I'm doing is too uncomfortable, by all means let me know right away and we will readjust. So the first step is just making sure we see the cervix, and we can see it really clearly now, and I always check to make sure I'm not pinching you. I'm not pinching you at all. Perfect. So the next step is just prepping, and the prep is just a cotton ball with some fluid on it, and we just apply it to the cervix to make sure that we are not causing any risk or chance of infection. And especially for patients that have had a previous history of infection, you want to make sure that they're treated with antibiotics if there's any risk of chlamydia or gonorrhea in the past. And our patient tonight is absolutely squeaky clean, so nothing to worry about in that regard. So you may feel some fluid dripping out, and that's just that cleaning fluid, nothing to worry about. And I'm going to set everything up here. This is the catheter. It's only about 1 millimeter wide, and this just slips into the cervix very gently. Sometimes you might feel a little bit of cramping, so you're going to feel just the catheter going in. This might feel a tiny bit crampy. If it's too uncomfortable, again, let me know, okay? And then we very slowly insert some air into the balloon of the catheter to get it to fill, and hopefully that holds it in place. And there are times where it'll slip out or it's in too far, and we can readjust that in a minute. So I'm just going to take the speculum out. You're still doing okay? Perfect. Anything really uncomfortable so far? No. Perfect. Okay, so we keep everything handy just in case we need it again. The lights are motion sensitive, so we turn that off. And now we're going to start with the ultrasound. So you'll just feel a little bit of pressure as the ultrasound goes in. You're not latex sensitive, correct? And if I'm doing anything again that's uncomfortable, let me know. At this part, we cover the patients up totally, and we're going to start with the ultrasound. So we're just looking at the uterus and the image of the uterus to see where it is, the position, the quality of the uterus, and so on, and the quality of the lining. You may feel a little bit of pressure, and again, if I'm pushing too hard, let me know. So the uterus here is going kind of down, so it's a little bit retroverted, but then it goes forward, so it's antiflexed. And we have a really nice triple layer lining here. So the first one's where I've put the cursor, the middle one is the junction between the two layers, and then there's the third layer there. So that's a beautiful triple layer lining. Then we're going to measure the uterus itself, and it has to go on a bit of an angle, otherwise you got to bend the curve. And then the lines should be perpendicular. And this is the uterus transverse and coronal as well. And here you can see a little bit of an area that's different from the surrounding area right there, and that's a fibroid. So that's kind of what a fibroid looks like. And so we'll just measure the fibroid there. And that fibroid right now measures an average of 2.69 centimeters or 26 millimeters. So that's a very small fibroid, and it looks like it's well away from the lining. So this is the edge of our lining right here. That's the fibroid. So we're not really close to one another there at all. The ovary right now is hiding on us, and that's okay. So sometimes we push down to see the ovary. It's actually still hiding on us. There it is. I see it. It's gone a little bit deeper. So the ovary is down here, and I'll measure that right now. And sometimes it'll move around because ovaries can be quite mobile. So we're just going to do some measures of the ovary. You're still good, no discomfort or pain or anything? Amazing. That's what we like to hear. And you can see some of these follicles, especially if I brighten it up a little bit. So you see these little circles here, that's a follicle. An egg is growing inside there, and there's a few more all throughout. And when we need to, we measure those. Okay, and then the left ovary is right there. So you can see it on that side. And we'll measure that now too. And that's a perfect picture of a follicle again right there. You can see it, nice big egg developing right there. That's the follicle. The egg is actually microscopic. You can't see it inside the follicle. So if you have the right technology, which obviously we do, the next step is to generate a 3D image. And so you want to get as much of the uterus into view. This is just warm saline. So this is really critical. You want the saline warm, and you got to inject it slowly. And so that's what we're going to do next. And as long as you go really slowly, most patients won't even feel this. And certainly if you feel any discomfort or pain, I want you to let me know right away, and we can easily back off or ease off at any point in time that we need to. So if you can catch the screen there, you'll start to see the fluid going in. First it goes in a little bit white, and then it'll clear up and it'll be a bit of a black blur right there. And you can see that the lining looks quite clear. And we're just going to push this button. I'll continue sort of injecting. The ultrasound is processing a 3D image. So I've been infusing that whole time. Was that painful at all for you? No. Nothing? Nothing. Awesome. So this really doesn't have to be a painful procedure. If you've got a conscientious individual performing it, it doesn't have to be uncomfortable at all. We'll do some digital manipulation here, and this takes about less than a minute for me to do. And then I'll pop up a nice picture on the screen, and you will see how beautiful this uterus is. So that is the outside of the uterus all around there. That's the outer margin. And this is the inside of the uterus, and you kind of want it to look like an upside down piece of pie or a almost like an ice cream cone. And you can see as I'm kind of moving backwards and forwards here that that's what that looks like. And certainly there's no evidence of any intrusion from the fibroid. The cavity is perfectly normal, so it is not interfering with the inside of the cavity. The ones that do, we definitely need to deal with. The ones that do not interfere with the inside of the cavity, we don't have to deal with. And here, we're going to just very gently inject some air bubbles. And we're going to watch to see if they go through the fallopian tubes. And again, this might feel a little more crampy. You can kind of see them just exiting at the bottom right there. So we know the right side is open. And on the left side, we'll probably be able to see them too, although sometimes it's preferential. You can't always see it through both tubes. So right there you go. On the left side, you can just see them escaping as well. Any pain there? No. Yeah, so painless procedure, no complaints. We're just going to take everything out now. So you'll feel the catheter come out and the ultrasound probe come out. And occasionally you'll experience a little bit of dripping as you sit up. So we often provide the patients with a pad. And there's a change room right next to us here, a bathroom as well for anybody that's got any discomfort or needs to clean or anything like that. And that's the whole procedure. So very simple, completely painless. Our amazing volunteer tonight was very gracious to help us out. So a big round of applause for C. She's an amazing lady all around. and painless. By her own admission, you heard it live here. So if you're going for a saline infusion sauna histogram, make sure they're warming the saline, make sure they walk you through every step and they're telling you what's happening at each stage, and make sure they flush in that fluid very, very gently. As long as you do that, it's not uncomfortable. It doesn't have to be scary or terrible at all. Hope you guys enjoyed the video. Have a great night, and thanks again for watching.